Patients grappling with chronic pain are often prescribed powerful medication to help them. But there are indications that more and more are getting hooked. A study this week concluded deaths from opioid overdoses are up, way up. And as Jennifer Tryon reports, the victims are often in the prime of their lives.
Her son is proof opioid addiction is killing more young people than any other group.
I didn't need this study to confirm it for me.
Nearly 1 in every 8 deaths in Ontario between the ages of 25 and 34 between 1991 and 2010 was related to opioid use. Her son Michael was 29 years old when she found his body.
We don't have to abuse these drugs. My son didn't crush, didn't snort, didn't inject. He took them as directed, and it started him on a slippery slope.
An opioid is the pain-killing ingredient in drugs like oxycodone and heroin. Between 1991 and 2010, deaths have increased in Ontario by 243%.
The resources for youth and young adults in terms of treatment specific to their needs are very scarce in our province and across the country.
Strides have been made by government and even drug companies to protect Canadians from opioid addiction, tamper-proof formulas, and new prescribing guidelines. But it's not helping young people stay away.
I think there's an awful lot of sharing out there. Family members, friends, well over 50% of the people who've used an opiate for a reason they weren't supposed to are getting them from friends and family for free.
Experts say governments need to build on a model of prevention, not treatment.
Certainly as a new minister, I'll look in more detail at the strategy as well going forward to see if there are any other measures that we could put in place as a result of this information.
But let's have some action. Let's resolve the epidemic.
Anything less, this mother believes, will lead to more young deaths. Jennifer Tryon, Global News, Toronto.